Hi, I'm Dr. Minerva Santos, and welcome to Your Health Today. My guest today is Dr. Anthony Sgouros, who is a gastroenterologist in the Westchester area. He's been around for a really long time. Patients love him. He has a great bedside manner, and I'm really happy to have you as my guest today.
Great to be here, Minnie.
Thanks. I know, you do colon, but one of the things that you're going to talk about today is hepatitis C, which is really a very important topic, something that people really are unaware of. People may have it and not be aware of it, and it's not as simple as just a foodborne, hepatitis A. So I'm glad that you're here to talk about hepatitis C.
Yeah, there were three types of viral hepatitis that are common in this area. There's hepatitis A, hepatitis B, and hepatitis C. Hepatitis A is the type of hepatitis that you get when you eat shell food or other contaminated food. In other words, it's acquired by eating something, or oral fecal contamination. And it's generally a self-limited disease, meaning that you have the hepatitis or the jaundice, the yellowing of the eyes, and it goes away in a few days. And rarely do you get any kind of a chronic problem from hepatitis A. Hepatitis B also is a virus that most of the time results in a short-lived, self-limited liver illness that goes away and you're left without a problem for the majority of the time. Hepatitis C, however, is a different story. If you get hepatitis C, 85% of the time it's a chronic infection, and you only have to be exposed once. So if you have it, and you have to deal with it as you age and get older. It's not an uncommon liver disease. Hepatitis C is the most common chronic liver disease in this country. It rivals even liver disease due to alcohol.
Really?
1.8% of the population has chronic hepatitis C, or about 4 million Americans.
Right. Now, exposure. What do you have to do to get it?
Hepatitis C is mainly a blood-borne illness. You get it through contact with blood that is contaminated. This can be through blood exposures such as IV drug use, in which you share needles that are contaminated with someone else's blood. It can be through blood transfusions. Now, blood transfusions that were given before 1990 were not able to be tested for hepatitis C. We didn't know that it existed. We used to call it non-A, non-B hepatitis.
That's right.
So if you had a blood transfusion before 1990, you can get exposed. Other blood exposures, if you're a healthcare worker and you get exposed through a needle stick at work, that could also expose you. Hemodialysis patients are also at risk of contacting hepatitis C because there is some blood contamination in some of the equipment that's used. Also, tattooing and body piercing is a risk factor for the development of hepatitis. Sometimes needles are reused when you go to a tattoo shop, and that can expose you to hepatitis C. So there are many ways to get hepatitis C, but it's mainly through exposure through blood products. The question I always get is, can you get hepatitis C through sexual contact? The answer is yes, but it's actually an uncommon way to get exposed to hepatitis C. It is very common for a husband and wife to be married for 30, 40 years, one to be hepatitis C positive and the other negative, and that never changes over time, in spite of unprotected sex. Now, with that said, high-risk sexual behavior is a risk factor to acquire hepatitis C. If you have multiple sexual partners, and for some reasons that we don't fully understand, men having sex with men is a higher risk sexual behavior that increases your risk of contacting hepatitis C. So you can contact it through sexual contact, but not that commonly.
Right. Now, if you get exposed, what exactly happens? Because there are a lot of patients who are out there who have hepatitis C and don't even know it. They've never gotten sick. They just go along and we find it as a fluke because they have elevated liver enzymes, and then we check for hepatitis, we do a hepatitis profile and find it. So how do people know?
That's very true. A lot of people walk around not knowing that they have hepatitis C. Of the 4 million Americans who have hepatitis C, it's thought that only about 2.7 million of those 4 million actually know that they have it. And the reason for this is that when hepatitis C is first acquired, most of the time, it passes without any symptoms or mild symptoms that may be interpreted as a cold.
Right.
Things like fatigue, viral flu-like symptoms, some nausea. It's the minority of people who have significant liver test elevations when they're first exposed, and the vast minority actually get yellow or jaundiced. It's thought that about 85% of people with hepatitis C who first get exposed don't have any symptoms at all. So the way we usually pick it up is, as you said, with routine blood testing in the office. A lot of the time, there are mild liver test elevations of the transaminases, a type of liver test. There are two of them, AST and ALT. Usually it's the ALT that's elevated, and it's only elevated in a minor way in most people. The normal ALT level is around 40 or less. Patients usually have ALT levels of 50, 60. And that should spark hepatitis C testing because it is so common in patients who do have an elevated ALT level.
Now, once you, let's say you're positive, what is the person supposed to do? Because, like you said, some people it becomes a chronic disease, and then other people don't have any, quantitative and qualitative loads?
Well, hepatitis C can go down different paths. Now, if you're positive, there is a chance that you can become immune to it on your own. That's 15% of people. The other 85% of people who have been exposed to the hepatitis C become chronic hepatitis C patients. Now, a lot of these people may have the hepatitis C all their lives and never get a problem from it. About 20% of people with hepatitis C, chronic hepatitis C, go on to develop the complications of it. Now, the complications of it include cirrhosis of the liver, the same type of cirrhosis that you can get from drinking alcohol all your life, and liver cancer. And for those who get cirrhosis of the liver, so that's about 1/5 of people who get cirrhosis of the liver from hepatitis C, cirrhosis is a very serious disease. And those with cirrhosis usually have a life-threatening complication within 5 years of advancing to cirrhosis. And once cirrhosis is present, there isn't a lot that can be done other than liver transplantation. Liver transplantation, by the way, is a limited resource. Not everyone can get it who needs it. And right now in America, hepatitis C or chronic hepatitis C and the cirrhosis caused by it is the most common reason for liver transplantation, even before alcohol-related liver disease.
Right. But now, if you have the hepatitis C, can they still transplant you? Wouldn't you get the hepatitis C in your new liver?
Well, it is true that liver transplantation will not cure you of your hepatitis C, but hepatitis C takes a long time to progress to cirrhosis. It takes generally decades. Most of the people who are exposed to hepatitis C are actually the baby boomers, patients who were born between the years 1945 and 1965 or thereabouts. And they were exposed during the 60s, 70s, 80s through various lifestyle choices or through blood transfusions.
Oh, that free love.
And we're seeing those patients get older now. And it takes about 30 years having the hepatitis C for it to progress to cirrhosis. So because there's such a long span of time between acquiring the hepatitis C and getting cirrhosis, transplant works for hepatitis C.
Right.
Because you'll get the liver, and then you got another 30 or 40 years before it'll create cirrhosis again. So see, even though you do still have the hepatitis C in your body, it's not a contraindication to liver transplant at all.
Right. Now let's talk a little bit about what therapies are out there for people. What, like you have someone who has active hepatitis. What do we do? What's the first thing that we do for them?
Well, right now this is an exciting time for the treatment of hepatitis C because not only patients who have it and have never been treated before, but also patients who have been treated in the past with older medications will find it interesting that there are newer treatments now that can provide a cure. And I want to stress that hepatitis C is a curable illness at this time. We have a term in treating hepatitis, it's called the sustained viral response, or SVR. And we test for that 6 months after a patient has completed treatment for hepatitis C. If they're negative for the virus at 6 months, it is a cure. Those patients do not get cirrhosis, they do not get liver cancer, and if they don't have any cirrhosis already, they can have a normal life expectancy afterwards. Hepatitis C treatments have progressed over the years. At first, it was interferon alone that was used to treat hepatitis C. And with interferon alone, you only had about a 20% chance of actually getting rid of the virus and being cured. Then, a few years later, late 1990s, ribavirin, a pill, was introduced to be used with the interferon, which, by the way, is an injectable medicine. And that got the chances up to about 45% of getting rid of the virus. The current standard of care is to use a type of interferon called pegylated interferon. This is an interferon that, when injected into your body, stays there for a long period of time. So you only have to get an injection once a week.
Were you getting it every day previously?
Previously, when interferon first came out, it was a 3-time-a-week injection, and it was reduced to once a week. But having the interferon stay in your body at good blood levels for the entire week increased the eradication rate of the virus. It increased it to 50% when you used ribavirin in combination with it. Now, there's a new class of medicines that are available to treat hepatitis C. They're called direct-acting antiviral agents. And these are medicines that have been specifically engineered to attack the hepatitis C virus by looking at the virus's genetic makeup and where it's vulnerable. So there are 2 medicines that are going to soon be available within the next 6 months, I would guess. One is called tenofovir, and the other one is called boceprevir. These are a type of medicine class called protease inhibitors, and they act to inhibit the virus from actually seeding inside your liver cells. Now, the new treatment is only going to be 6 months, as opposed to now most people have to be treated for a year with the interferon and ribavirin. Now people will be treated with the interferon, the ribavirin, and the protease inhibitor, tenofovir. Yes. Now, with this treatment regimen, even if you have a difficult-to-treat subtype of the virus, which we call genotype, the chances of having a sustained viral response or a cure is over 75%.
That's great.
This is a big advance in the science. And these numbers, 75% eradication, hold, or pretty close to hold, even for people who have been previously treated with the interferon and ribavirin and have either relapsed or have not been responders to the therapy. So we do expect that a lot of people who have been treated in the past will be retreated, and it will also open up treatment to people who may have put it off in the past because of the discouraging numbers in terms of the chances of getting cured from the virus.
Right. I've had some patients who felt like they didn't feel sick, and given the side effects of the interferon and doing it for a year, they would decide not to do anything and just wait. So those are the patients who should step up now.
That's very true, because it must be remembered that 1/5 of people with hepatitis C are going to end up with cirrhosis. Now, it'll take 30 to 40 years for that to happen,